Brianna. This week from the reading and the audios, I really found a couple things that were surprising to me. I think the biggest thing from the article was that there's 15 million cases of children having mental health issues. That's a huge number. I really didn't realize that there was that many children that struggled with it. And I did know just from my education and experience that children, it starts from when they're little and then it carries on into adults. But I didn't know that it was that big of a number, and it just is surprising to me that that is happening. And I guess there's so much you can do if they're caught or not caught in those cases. And then we wonder what's wrong with our society. And that was just really surprising to me. Also, in the school nurses one, I remember when I was little going to the school nurse, and just when I was sick, so I guess I never realized what their job consisted of. I never realized that they did all of this, and on top of it, they had health screening to do and assess children and things. I think that was pretty shocking for me to realize that their job is way bigger than we actually think it is. And I really like how the two questions they said, is this student acting differently than they were before, and are they out of the norm of what is normal for them? I think that was really beneficial for me to learn, especially going into early childhood education, just to use as a guide if children are struggling or whatnot, and what to do or how to move forward from that situation if I notice those questions are arising in those students. And the last one for the mental health in kindergarten, I thought it was surprising that at such a young age you can already tell the direction the child's going if they're having mental health issues. And I like how the lady called them pink flags instead of red flags, because I think it's smart to get there from the pink flags before you get to the red flag. And what a difference. You can stop right there and try and fix it, I guess, before it gets bad and it affects the child for the rest of their life. So those were the three things I really took away that were surprising to me, and I guess I never really thought of them as starting that young for mental health issues. So question number 2, do you feel that schools have a responsibility to assess mental health of their students? I do. The main point, so as educators, we're the main point of contact with these children when they're not at school. And I think we notice a lot, since especially around a bunch of different children in different situations and different cases, and there's different things that we notice about different children. So I really think that us being the main point of contact other than parents and intermediate family, we can sit here and assess and figure out what is going on with this child, or something is different, or they're not themselves, what's going on. And I think we should really question those things. And I don't think anything's wrong with going further and asking for extra training or assistance from other people to make sure that you're getting the right, I guess, diagnosis per se, even though we don't diagnose people, but they can, I really think that as educators in the school district, in schools in general, we have a huge responsibility to notice these types of things and do something about it. So question number 3, what else can be done to help address mental health issues in school-age children? I really feel like there's a lot that could be done, and there's different ways to go about it, and different, everybody has different opinions and things like that. And so I really think that we should just use the additional resources we are given and extra help that we are given by other people. And I think the most beneficial would be for the staff to have trainings and to be educated on mental health in children so that we know what to look for and we know what to do if we see something or what steps to take. And I really think it'd be beneficial for every school to have a school psychologist that studies in all these types of things for children so that you can always go to them, ask them questions, ask them to observe the child, and see what we need to do next to help that child. And I think that we need to change our mindset to pink flags instead of red flags, because I really like how that lady was saying that if we get to it before pink flags or before red flags, if we look for those pink flags, then we can really make a difference and change the point from right there, and hopefully it can benefit them later in life. And that's my post for the week, and thanks guys, bye.